Back pain starts with human asymmetry. The fact that you have two diaphragms, one on the right and one on the left, that are not the same, meaning your right side of your body and the left side of your body and the right side of your brain and the left side of your brain are not the same and never will be. Most people, if you do not have an injury, you just have standard back pain, you go to the doctor, they do some imaging, they say, we can't figure out anything wrong with you, go see a physical therapist. They might try stretching, strengthening, but in reality, the issue is you can't breathe. I'm going to give a demonstration of these techniques right now. They're all designed to reduce the influence of the right diaphragm on your spine that is turning you to the right, your pelvis to the right, and your ribcage to the right, and arching your back. They are designed to reduce your overuse of accessory neck muscle, accessory back muscle, particularly the quadratus lumborums, that you start to use for breathing. These are all Postural Restoration Institute techniques. They come from the Postural Restoration Institute. And also after that, I give more context, more information. I go a little bit deeper into what you have to sense for each technique, what you need to feel. And also importantly, I give reasons why some people might not do well with them, because I can tell you they would not have worked for me many years ago because of my jaw and my teeth and my vision, which I've talked about a lot on this channel. Here is the first technique. This is called the 90-90 hip lift. It's a postural restoration technique. There's a small ball between my knees. You should feel your hamstrings near your butt, and you should feel your inner thighs. As you squeeze the ball with your knees, you lift your butt a little bit up off the floor, and you're pulling your heels down into the back of your shoe. And you breathe in through your nose and out through your mouth. Get all the air out. Inhale through the nose, exhale through the mouth. As I'm pulling my heels down, I feel my hamstrings. A lot of people will not feel their hamstrings. They'll feel everything else except their hamstrings. Or they might feel their right hamstring more than their left. The next one, this is the all fours position. Another postural restoration technique. You're going to pick up your right hand, just exactly like I did it. You'll feel your weight on your left hand and right leg. You should sense the ground come up underneath those two appendages. You should feel your left abdominals. I'm maintaining the rounded back position as I breathe. I'm trying to breathe, expand my left lower and mid back with air as I'm sensing my left abs, so that my rib cage actually expands with air and I don't use my neck and my back. Now here's a, a modified one. You're still on your hands and knees. You move your right knee forward, and you move your right hand forward. My back is rounded and I'm slightly side bent to the left, and I just breathe in that position. Now you're actually biasing the left side, because now also the towel underneath the left knee turns your pelvis to the left, because most people are living with their pelvis to the right because of this inherent asymmetry that's found within our body because of our bigger right diaphragm and just the way our brain functions. And then the final one, this is what I would do last. I'm sitting on my right hip. My left knee is pushing down into the towel a little bit, and I'm expanding the right side of my ribcage with air. As I exhale through my mouth, get all the air out. I feel my left abdominal wall because my left ribs and my left ribcage are coming closer together as the right side is being expanded with air. If you can do those, you are on your way to resolving non-injury back pain. We're talking about the back pain that no one can figure out what you're feeling. It's because of inherent asymmetry, right dominance, inability to diaphragmatically expand your ribcage with air, over-reliance on necks and lower backs for breathing, which create tension and extension patterns and limited movement. How does one breathe for these techniques? It's pretty simple. You do it for 5 breaths. You inhale through your nose, exhale through your mouth. You need to get all your air out, because if you're in back pain, remember, you're probably in extension in your rib cage with the pelvis forward on one or both sides. To get that to re-expand using diaphragmatic activity for non-neck breathing and non-lower back breathing, your ribs have to come down as you exhale, so your next breath can expand the rib cage backwards. So when you're breathing in, you inhale through your nose, exhale, elongate your exhalation, pause for 3 to 5 seconds before you inhale again, and then when you inhale, You want to feel your back. If you're lying on your back, you want to feel your back expand into the floor when you take a breath in. If you're on your hands and knees, you want to feel your back push up towards the ceiling. And you do that for about 5 breaths. You're trying to slow everything down. Remember, in through your nose, out through your mouth. You have to get the air out before you, all your air out, before you can take a good diaphragmatic breath in. Requirements. You have to wear shoes. If your feet are up on a wall, you have to have sneakers with a stable heel. They cannot be minimalist and you can't be barefoot. Your brain will not sense your heels to give you hamstrings. If you do not feel your hamstrings closer to your butt, if you feel it behind your knees, if you feel your calves, your quads, you're not grounded. You cannot breathe at that point. Now, what are the muscles you should be feeling? Well, like I mentioned, in the 90-90 position with your feet on the wall, you should feel your hamstrings closer to your butt. If you're squeezing a small ball or a roll of toilet paper between your knees, and you're squeezing your knees together, you should feel your inner thighs. As you pull your heels down, you should feel your hamstrings closer to your butt. If you're feeling your calves, your quads, your back, your neck, or your hamstrings closer to your knee, you're not grounded and you cannot breathe. Now, something else that's very important to sense when you're doing this 90-90 position, and you put the ball in small or paper or no yoga block and no foam roller. No other random objects, a roll of toilet paper or a small ball that you can squeeze. When you pick your butt up, you should feel your back push into the floor. All right, so as the butt comes up, back, you should feel your back push into the floor. If your butt comes up and your back comes up, you're extending, you're overarched. It's not going to work. It's just the butt that comes up. Don't lift your whole body up. That's not what it is. Don't turn it into a gym exercise either, because that's not what it is. This is a sensory experience for your brain to relearn how to diaphragmatically breathe with hamstrings that are now supporting your pelvis by pulling it back. That pelvis has to be the platform, the stable platform off of which we expand our ribcage for diaphragmatic breathing. If your butt comes up and your back arches, you're not able to turn off your hip flexors, or your lower back or your neck is keeping you in that position. It will not work. You'll probably just feel, well, you either feel strain or you'll feel really nothing appropriate. If you feel your right hamstring more than your left hamstring, which is pretty normal outcome, you can then bring your awareness to just your left heel, keep pulling your left heel down, but just sense the arch of your right foot. That might change how you're feeling your hamstrings. If you like this video, could you like it, comment, subscribe, or share it with others? Thank you. With the all fours position where you lift up your right hand, as you pick that right hand up, you should sense the ground come up underneath your left hand and your right knee, and you should feel left abdominal, internal oblique activity as you're breathing. If your body drops down when you lift up an arm, if you can't stay rounded, if your body weight shifts over to the right, because remember, even though you pick up your right hand and you're going to feel your right knee, you don't want to move over to the right side. You got to stay more in the center. You should be able to feel, actually, when you do that, you'll actually naturally kind of crunch down slightly on that left side, and you should be able to feel some left abdominal activity and maintain it through the full 5 breaths. It is not easy. If you're not feeling anything, it's because you can't inhibit your back. You're too tight. The biased all four position, where your right hand is slightly forward and your right knee is slightly forward and your back is rounded, again, you should feel your left internal obliques, your left abdominal wall, as you breathe into your left mid-back. That's where we're breathing quite a bit. Or you can think about breathing and expanding the right side of the rib cage with air. But we want left abs. That's the pump. That's that's what holds everything together. So we can use a left diaphragm to pump air into the right side of the rib cage and our left posterior rib cage. And then this side-lying rest position, as Postural Restoration calls it, you should be sensing expansion, a stretch through your right side. When you take a breath in, as you exhale, you should feel left abdominal activity. Then you want to hold on to that left abdominal activity as you're pressing your left knee down into the towel. You might feel some left inner thigh. As you take a breath in and you're still feeling these things, you're more than likely using your left diaphragm to pump air into the right side of the ribcage. Who might not this work very well for? People who are hypermobile. I've discussed that in other videos. People who are just very, very stretchy or are very, very unstable, they may need to start with other techniques that are more fashioned for them, let's say, because remember, there is no one postural restoration program for every single person because we all have different bodies and different brains. People who have a very strong forward head posture or a straight neck or a reversed neck, which is what you'd be seeing here. People who are cranial patients, visual issues, jaw and teeth issues. I have a lot of videos about that. Those people are also going to be neckized people. They're going to probably have necks that don't relax enough for you to reground yourself through your hamstrings, and which will mean you're not going to be able to expand your rib cage appropriately for diaphragmatic breathing. Back pain is because one or both sides of your rib cage are going to be forward. One or both sides of your pelvis will likely be forward because of normal human asymmetry. Back pain is actually generally one of the easier things to treat because most of it has its origins, even if, the amount of times it's the QL muscle or the hip flexors, psoas muscles that are blamed for back pain or weak glutes. And yeah, all that can be true. But the reality is the hip flexors and the psoas muscle, they attach right into the diaphragms, and you lose your diaphragms when you're overarched, when you're in this extended posture. And the techniques that I'm going to show are all techniques that can be used to reverse that extension posture so that you can reestablish diaphragmatic breathing. So your back can open up with air. All those tight back muscles that are tight when you're in this type of extended posture, they will release. So expansion, breathing, the lack thereof is usually the culprit of this back pain that people can't figure out where it's coming from.